Thank you. For me, COVID-19 was personal. I lost my uncle to a COVID-related illness on the 29th of March 2020. And one of my colleagues, Edward Radoliak, who's an oncologist in Croatia, while reaching out to me to sympathize with me on my loss, said this chilling statement. He said, "People are starting to fear a COVID-19 diagnosis more than a cancer diagnosis." But where was the evidence? We rapidly reached out to cancer centres and hospital trusts across the United Kingdom to actually see whether this statement was true or not. Unfortunately, it was. What we found was, when we looked at cancer referrals, so early warning system for suspicion of cancer, 7 out of 10, that's not a mistake, 7 out of 10 people with suspicion of cancer were not getting access to cancer specialist services. Similarly, 4 out of 10 people were not getting, cancer patients were not getting access to their chemotherapy. This was the first data that drew the impact of COVID in the United Kingdom, and thankfully our government listened to us and actually acted and went to restore cancer services. Unfortunately, the impact was felt right across the cancer pathway, so from prevention, diagnosis, treatment, and also cancer clinical trials and research. And the impact has really been catastrophic. If I just take an example here of endoscopy procedures, so in terms of diagnosing cancers of the gastrointestinal tract, what we can see there is a 90%, yes, a 90% drop in endoscopy procedures pre and during the pandemic. And then we looked to see what was the impact on excess mortality. This is a modelling study we did, and critically we found that between 7,000 and 18,000 excess deaths were possible for people with cancer. Again, a very worrying figure. The other thing to remember is these are numbers, but they all represent individual people, and we always have to remember that. We've really seemed to be going one step forward, 2 steps backwards. Yes, we have succeeded in improving cancer outcomes over the last 2 decades. However, the last 2 years may have really stepped us back in time. And if you look here, for example, for colorectal cancer, we may have gone back almost a decade in relation to our projected 5-year survival rates. So a cancer backlog has accumulated and continues to accumulate. And I will say getting back to the previous normal is just not good enough. We estimate to be working at least 130% of normal to actually address that backlog. Data also helps us to support the recovery. This is just an example that we showed in colorectal cancer, where the fecal immunochemical testing not only can help you to save lives, but also can preserve vital screening services throughout the country, so that it can only be used when it's absolutely necessary. And so we're looking at saving lives, but also preserving activity. We presented this data to the European Cancer Organization and to WHO Europe. Immediately, the European Cancer Organization launched a special network on the impact of COVID-19 on cancer, which I'm proud to co-chair with Miriam Cruz. We rapidly convened a group from across Europe, cancer patients, healthcare professionals, experts, and we came up with a 7-point plan to build back not only better, but smarter. You can see cancer backlog at the top of the agenda, but also very important, restoring the confidence of European citizens and European patients in cancer services. And you can see there, workforce, strengthening cancer systems, critically rapid deployment of cancer intelligence, and a number of speakers have touched on that. Critically, our message was, don't let cancer become the forgotten sea in the fight against COVID-19. Cancer needs to be at the top of the recovery agenda, as both Mary and the Commissioner has said. And so we then set up a Time to Act campaign. So a campaign that combined a data intelligence study with particular messages to across Europe, which we presented to the European Beating Cancer Committee in May 2021. Here's just some of the data that's come from this. 100 million, that is not a mistake, 100 million cancer screening tests were not performed in Europe. And the impact, as the Commissioner said, 1 million cancer patients could be going around with a cancer diagnosis they don't know they have. We're in a race against time to identify these missed cancer cases. This data intelligence then has informed the Time to Act campaign. What we say is cancer won't wait, neither should we. We've translated it into 30 languages. Our messages are very clear. For citizens and patients, don't delay. See your doctor if you have warning signs of cancer. Cancer services are safe. For healthcare professionals, because many of them have shown anxiety, signs of clinical depression, really, we can help you. You're not alone. But critically, for policymakers, for health system leaders, and for governments, cancer must be put back on top of the agenda. Every action that we do now will save lives going forward. And we've now had a European launch, which the Commissioner very thankfully hosted for us. I'd like to thank the Commissioner both personally and on behalf of the European Cancer Organisation for her efforts in relation to cancer. We've now had launches in 12 European countries. I'd love if Greece could be the 13th, so come talk to me afterwards. And also, really, it's a Europe-wide campaign. Every action, as I said now, really can be beneficial to European citizens and citizens from Greece. Thank you very much.